Hello, everybody. Thank you for coming. First of all, welcome. It's a pleasure for me both to be here and to moderate this panel. I'm hoping that I will be able to both contribute and learn from the great list of speakers we have, and also from you who are present here in terms of your questions and your interactions. My name is Paul Quinn. I'm a legal researcher at the Free University of Brussels, the Flemish version, the Vrije Universiteit Brussel. I've been here for quite a while, and I've always been interested in matters of law that relate to healthcare delivery and the use of information. My background is both I studied originally biochemistry, but then transitioned into law, so I've always been interested in this area. And what interests me the most is the use of patient information in the medical context, either for healthcare treatment or for research. And thus I'm naturally interested in e-health and m-health, because information is obviously critical to those processes, and in some ways you can define those processes but by the novel use of information and what they are able to do through that novel use of information. And that may be things such as changing the delivery of healthcare from the perspective of the patient, from the perspective of organizations. These bring with them positive benefits, of course, but also a range of negative benefits. And I'm sure we're going to hear about, not negative problems, sorry. I'm sure we're going to hear about these today. My experience, I've worked on a range of European projects that have involved e-health and m-health issues. We've been asked at our university to look at these things from a legal point of view, so that is primarily my area of interest. But I've also seen many of the other issues that occur. I'm currently working now, for example, on a project called Picasso. And the aim of the project is to create a federation of patient healthcare records for chronically ill people. So the aim is that, for instance, that say a rheumatologist that is treating someone, he will also have access to other records that are created from other relationships. But this is very problematic. The project is set in Italy and Germany, and this is also set against the emergence of the GDPR. So there is a wealth of legal issues that we're trying to grapple with, and it's creating a lot of heated discussion on the project. And we're going to talk about some of these today, I think. We're in a state of flux, both in terms of what the technology allows, what the law allows, and the creation of the GDPR and the emergence of the new medical device legislation are testament to this, and they create an enormous range of questions that apply to m-health.